The commonest reason for the spine injury is road traffic accidents. It is a government rule, so we follow it. It is not like that. The government rule has made to follow us for our precautions. अगर आप जब भी एक्सीडेंट देखते हैं, आप प्लीज़ अपना मोबाइल में ना निकालिए. आप अपने मोबाइल अपने पास रखिए. क्या करते हैं, आप अपना गाड़ी में से कोई टॉवल लेते हैं या कोई बेडशीट लेते हैं या कोई कपड़ा लेते हैं, आप पेशेंट को डाल देते हैं, देखिए आप एम्बुलेंस में अपने कार में शिफ्ट कर देते हैं. नो, प्लीज़ डोंट डू दैट. Stop doing that. You are injuring more to the spine.
Hello everyone, welcome to Medwiki. I am Mrs. Prerna. Today I am very pleased to introduce Dr. Adil. He is a consultant neurosurgeon at Malhad Lifeline Hospital, Shimoga, and a visiting consultant at Karnul Hospital, Gulbarga. He has completed his MBBS, MS, MCH, and he has a vast experience of even more than 7 years in handling patients and managing them with spinal and brain trauma, tumors, etc. I welcome you, sir, and thank you for being here with Medwiki today.
Thank you very much, Ms. Prerna. Um, I'm glad that I'm with you people and I'm doing this podcast with you people. And I'm happy that this message is going to reach to all the common people where they lag behind about the services, like what lag behind about the knowledge of what they are supposed to do in whenever they see this kind of things in the future. So it's kind of sharing knowledge to them and sharing awareness to them, so that first aid in India is one among the debatable topic where in traumas in about the traumas and also in conferences we take up in a large scale to how to educate the people. So there are some sessions for the ambulance drivers, some sessions for the paramedical staff. Now this is one of the media where we can reach to the common people instead of using their mobile phone and capturing the video what they are supposed to do it. That is what we are trying as a neurosurgeons, especially young neurosurgeons, how to save the lives and so save the mortality of the person who met with injuries. So it's really happy I got this platform. So let's see how much I can reach to up to your expectations.
I'm very sure, sir, that this talking with you is going to really be helpful for our viewers and even for us to understand, because this we just call it a spine, but then the importance of spine is, we know in one word is that it supports our body, and that's, I think, the major thing in whatever we do.
Yeah, in fact, spine is something like a spine itself is a very important structure thing where everything is based on it. You take head, head is again it is an axle where it is again paired with the spine. You take a thorax part, again it is based on the spine. The lumbar part, whole of the body is definitely, it is like a pillar of the this one. Without the spine, we tell even in the words, without the spine we can't do anything. So it is without the spine, a body can't exist. It's simple as it is.
Yeah. So if we talk about a little more about this
Sure,
pillar
sure,
that you
Tulsi.
just mentioned, so if you can just tell us, like, what are the different parts of our spine? Because what we know is it starts from the skull and goes
Yeah,
to the
yeah.
tailbone, but I don't think we know the different
Yeah,
parts are there.
so that's a good thing. We have divisions of the spine. The cervical spine we call it a neck region. That is called a cervical spine. Then we call it the chest region or the back region, upper back region. We call it the dorsal spine, or it's a thoracic spine also. Then we come to the lower part that about below to this abdomen. It is called lumbar spine. Below to lumbar spine, that is the sacral spine segment. So this is how it is divided. So the division is for many reasons, because of many anatomical changes, nerve distribution, and many other reasons where there is regional distribution is there. So this is how this spine is divided, and every spine sector has different numbering for us, like C1 to C70, 1 to T12, L1 to L5, and sacrum. So these numbers are given for the nerve distribution, and this numbers has given for the anatomical distribution. So we have to understand this small basic anatomy, like these are the segments of the spine. If this particular spine get injured, so what are the things we are supposed to do it at different like example, if you are talking about the spine, the injury will mode of injury will be different and the treatment will be different. If you are talking about dorsal spine, then injury of the dorsal spine will be different and the treatment will differ. Whereas same as in the lumbar and sacral region. So the region differs and the treatment differs, and the first aid differs. That is what the main concept is.
That's too much to understand. So being so of course you're a neurosurgeon, so you must have seen many cases of spinal
True.
injuries. So why does this spinal injuries happen? What causes these
Yes,
injuries?
it's a very this one the main topic. The why we have taken up this spinal injury. The commonest reason for the spine injury is road traffic accidents. Yes, definitely because of the high speed vehicle. It can be a car vehicle or it can be a heavy motor vehicles, or you can take up the bikes or bicycles. What happened in our setup, like Indian roads and Indian this one, we are not using our protections. Like example, if you are wearing a seat belt, we are not aware why we are wearing a seat belt. It is a government rule, so we follow it. It is not like that. The government rule has made to follow us for our precautions, for our safety. We are not thinking about that. Oh, police is there, put the buckle. It is not like that. Then police, you can see the police. Can you see the accident before it arrives? No. Can you see? Can you predict? I'm going to meet with an accident? No.
Right.
So why we are not taking the precautions? The media, why I selected the spine injury? It is because to educate the people. Belt is not important for only for the police sake. Belt is important for our own life. That is what. So example, if you are working in a place, labor, our labor will not take much serious about the precautions, like you are supposed to wear the helmets, they are supposed to wear the gears wherever they are wearing, where they are supposed to wear their braces when they are working on the high feet areas, or where they are working in the place where you are exposure of your materials are very high, like instruments and all the things they can fell down on your head, on your back. So let me tell you in short, like especially the what we categorize is road traffic accidents, then the injuries at the workplace, then another one is coming up now is the sports injury. These are the main injuries what we encounter it. So in among these, the top is the road traffic accident, either it's can any kind of vehicle it is, followed by sports injury and followed by the workplace injuries. So now the question is, sir, like what are the common injuries we see? See, as a common injury we see in the all the segments I said, okay, cervical we got it, dorsal we got it, lumbar and sacral region. The commonest place to get injury is the lumbar region. Lumbar region is something in the lower part of the spine where five segments are there, and this bear our whole body from top to bottom. So whenever we fall down or whenever we met with an accident, the pressure, the inertia, the everything will be more on this region, L1 to L5 or sacral region. So this will get fractured easily because of the weight bearing. That is one thing. And once it is fractured, it is not limited only to the fracture of the bone. No, spine consists of few things. Like example, you take it as a bone, then the muscles attached to it, then the nerves which comes out from it. This all the things structures inside it, and moreover the blood vessels. So once it is fractured, so all these things, blood vessels, nerve, muscles, bone, all these things get damages.
So, like we were just discussing that you were telling us that these workplaces and sports, playing sports, and especially the road accidents. So, can you give some suggestions like what precautions can we in general take to prevent ourselves from these spinal
Yeah.
injuries in these cases?
Yeah, see, as I said, you like very on the road traffic. Usually, what we see it when we retrospectively ask the questions whether you are wearing the seat belt or not, they will tell no. In a working place, they will not use the helmets and the
Right.
braces. And in the road traffic accident, this common thing is not wearing the seat belt. Again, the precautions what they are supposed to take it, they will not take it. And in the sports, also same thing, not wearing proper gears and proper protectors. This is a most important things what they forget to do it, and they just neglect it. That is the reason where they met with an accident.
So, I think these are just the very general precautions that we know, but we don't avoid with them.
Definitely, definitely. Yes, definitely. As it is very easy available, so it is easy forgettable.
Right. You're right. So, moving forward, like how does these spinal injuries affect an individual? What effect does it have?
Yes, this is very important, and this is where we land up seeing patients losing their life, losing the limbs, uh, bedridden, all the things. See, as I said, okay, we got a cervical spine, neck region. So we'll talk about the neck region. If neck region, its cervical region get fractured, get injured, so what will happen? See, just I'll give a small example. There is a water tank kept in the building. If the upper part of the water tank is blocked, you will not get supply to the lower part. Same as it is. If our upper part of the neck region is getting disturbed, fractured, or some problem in this one, so lower part will get disturbed. So as simple, severity of the injury, severity of losing the limbs. See, as we know, this is upper part. Upper part will have all kind of supply to the lower part, including heart, lungs, kidneys, all organs, including your upper limb and lower limbs, hands and limbs. So, if any injury to this region, definitely patient is going to be on a bed rest for lifelong. It can be severity of the injuries. That one we have to think about it. One thing. This is about cervical region. Now coming to thorax region. See, as I said it, thorax is the upper part of the body. So definitely it supplies to the chest region and the abdomen region, and same the nerves get innervated to the organs also. If this get fractured, above to it will be can be a normal, below to it definitely will get disturbed. So the nerve innervation, the nerve supply will definitely get hampered, and the person who met with an accident will definitely will not have proper functioning of this regions below to this level. So this includes your kidneys, all the organs, even the chest and the lungs also. This is what happens when the dorsal thoracic spine get fractures. Now coming to lumbar region, this is most important. See, a fracture in the lumbar region which bears the upper part and it innervates the lower part. So when this fracture happens, so the person can't bear the upper part. Weight bearing of the upper is on the lumbar spine. So he can't bear the weight, and the lumbar nerve which comes out from the lumbar region which supplies the lower limb and the urinary bladder and the control of the defecation, this also will get disturbed, and person who met with an accident can't move at all, so but can move the upper part, so the lower part will be not move. So it is like a complete loss of the lower limbs. So definitely if loss of lower limbs is like he can't walk properly. These are the three segments what we usually see in fractures, and these are the effects what happens after the fracture.
So I was just asking you that while I was listening to you, it just came to my mind to ask you that are these like you said, it's lifelong. So is it really lifelong, long term thing? Like it takes a little more time to get treated, or it's just for the lifetime?
Yes, yes. Coming to that point, see again, it depends on the severity of injury. As the severe of the injury, that depends upon the mortality and morbidity. See, where especially and also in the region. If the severe injuries in the spine region, if patient fell down from the height, usually it will be a fall from the height about 10 feet. This one they will fall down, so there will be fracture. Once it is fractured, there will be contusion to the spinal cord that will be affected for lifelong, and the survival will be very very less in the cervical injuries. As I said, okay, it supplies whole to the organs, whole to the lower body. Patient can't move the limbs, it is completely paralyzed. All the four limbs get paralyzed, all the organs get paralyzed when it is for cervical region. If it is a moderate kind of injury, patient can move, but only some kind of movement will be there, but not to the this one, so that they can execute the daily life. In mild injuries, yes, they can. After some kind of surgeries or some kind of physiotherapy, some kind of therapies, then patients slowly, gradually get the power in the limbs, and then they start working for it. But it will be not like a normal. It won't be like a the life what they had before the.
So of course it's lifetime concerns.
It is. It is. You can think. You can
So
think that.
after listening to all this, like this lifetime issues or morbidity, mortalities, so I'm sure that this must be a very psychological stress. So if you can just put a light on it, like how does it
Yes.
affect him as well as the family? Like what loads does the family get after that?
Yeah. Yes, yes. See, as you know, can neuro, brain and spine are the main important things whenever it is get affect, an individual will definitely get affected. But as their partners, spouses, they will also get definitely be affected. And if the person is a bread earner for the family, then the whole families get shattered. And if in case if it is a secondary person also, then also he or she will definitely be a dependent person on someone else's life. So there will be a lot of psychological changes in the patient and into the family persons, definitely because of the trauma what he or she has received from the injury, because of the financial losses, and because of the ongoing treatment that losses, that medical treatment and the physiotherapical treatment, the therapy is what they need, the financial losses that will definitely concern them, and that give a lot of psychological effect to them.
So one thing more that's coming to my mind is like if somebody's somebody's suffering from spinal injury, how can the people that are around, like you started like just with a not making only the videos and taking photos of that person. How
So
they
you
can
mean to ask you mean to ask what they can do as a
yeah,
first
how
aid?
they can help, yeah, how can be the first thing that they can help.
Yes, absolutely. Yeah, this is the main thing I want to club with English and Hindi, because let it reach to the common people. Thing is, whenever आप जब भी एक्सीडेंट देखते हैं, आप प्लीज़ अपना मोबाइल में ना निकालिए, आप अपने मोबाइल अपने पास रखिए, अपने सराउंडिंग्स को, जो पेशेंट आप जहाँ विक्टिम है, जहाँ पे पेशेंट है आपका जो इंजोर्ड है, उसको आप अच्छे से सराउंडिंग अपना एरिया पूरा सर आप ये रखें कि सो दैट गैदरिंग ज़्यादा ना हो, एयर इजी ले सकें, make him that he or she is doing taking clear air, normal air he or she is taking. Okay, then just see what position he felt and what is the pain he is complaining. One thing, अगर वो नहीं बोल सकता है तो आप देखिए उसका हाथ और पैर का मूवमेंट हो रहा है या नहीं हो रहा है, ठीक है। अगर समझ रहे आप, आपको लगता है इफ यू आर फीलिंग दैट देयर इज नो मूवमेंट एट ऑल, आपको लगता है कि हाथ पैर में मूवमेंट नहीं है, हरकत नहीं है, तो आपको समझना है कि उसको गर्दन पे चोट पड़ी है, हाथ और पैर दोनों की, ठीक है। अगर सिर्फ आपको लगता है कि पैर में हरकत नहीं है, मूवमेंट ऑफ द अपर लिम्ब इज देयर, देन थिंग आप उसको समझना है कि उसको बैक पे चोट लगी है। तो आपको ये करना है कि कोई हार्ड स्ट्रक्चर लेना है आपको, कोई सॉफ्ट स्ट्रक्चर नहीं, और विदाउट एनी स्ट्रक्चर। यूजुअली क्या करते हैं लोग, अरे गड़बड़ी में आके दे गेट हरी अप आफ्टर सीइंग द एक्सीडेंट्स। दोज हु वांट टू हेल्प दे शुड हेल्प इन अ प्रॉपर वे, बिकॉज देयर हेल्प शुड गेट बेनिफिट टू द पेशेंट, नॉट समटाइम इट वर्सन्स इट। इन स्पाइन इंजुरीज ऐसा होता है कि आप क्या करते हैं कि गड़बड़ी में कोई चीज़ मिलता नहीं है आपको, तो आप क्या करते हैं, आप अपना गाड़ी में से कोई टॉवल लेते हैं या कोई बेडशीट लेते हैं या कोई कपड़ा लेते हैं, आप पेशेंट को डाल देते हैं, देखिए आप एम्बुलेंस में अपने कार में शिफ्ट कर देते हैं। नो, प्लीज डोंट डू दैट, स्टॉप डूइंग दैट, यू आर इंजरिंग मोर टू द स्पाइन। आप ट्राई ये कीजिए कि एक कोई हार्ड स्ट्रक्चर आप ले लीजिए, कोई लकड़ी का अगर आपको वहाँ पे प्लैंक मिलता है तो बहुत अच्छी चीज़ है, या कोई लकड़ी का बाम्बू मिलता है तो उसको आप उसको थोड़ा सा टू टाइट उसमें टाइट करके आप पेशेंट को स्लोली आप उस पर रखेंगे, देन आप उसको हॉस्पिटल शिफ्ट करेंगे। क्योंकि ऐसा होता है जब इंजरी होता है तो इंजोर होके वहीं पे वो रुक जाता है। जब इंजोर होने के बाद जब मूवमेंट होता है तो हमारा स्ट्रक्चर जो है एक एक बोन के ऊपर दूसरा बोन ऐसा बैठा रहता है। जब मूवमेंट होता है हमारे शिफ्ट की वजह से, तो ये मूवमेंट होने की वजह से जो वर्टिबल बॉडी जो बोलते हैं वो एक दूसरे से स्लिप होते हैं, स्लिप होके वो जाएंगे एंड अंदर जो हमारा स्पाइनल कॉर्ड रहेगा, दूसरी भाषा में आप कहेंगे तो नर्व का जो बंडल रहेगा उसको जाके टच करेंगे तो वो और ज़्यादा डैमेज होगा। तो हाँ, तो पेशेंट बोलेगा सर मैं तो अच्छा था, मेरा मूवमेंट हो रहा था मुझे, बट आपकी शिफ्टिंग में आपके एम्बुलेंस में मेरा पैर चले गया। आप हमारे पास हम देखते हैं कि वी सी इट, नो सर आफ्टर एक्सीडेंट आई वाज मूविंग माय लिम्स एवरीथिंग फाइन, बट व्हाइल शिफ्टिंग आफ्टर शिफ्टिंग आई गॉट दिस मूवमेंट, देन विल कम टू नो दिस इज बिकॉज ऑफ द ट्रांसपोर्टेशन, दिस इज बिकॉज ऑफ द शिफ्टिंग। इट इज सेकेंडरी इंजरी, प्राइमरी इंजरी तो आरटीए हुआ है, सेकेंडरी इंजरी बिकॉज ऑफ शिफ्टिंग। सो पीपल शुड बी लिटिल प्रिकॉशंस, दे शुड shift the patient in a hard planks, in hard structures, and slowly gently bring it to the neurosurgeons, then it will be our work to further look after to it. It can be any place. If you are talking about cervical spine, if you are talking dorsal spine, but just a simple hard plank, just shift it.
Okay. So coming to the point, like you said कि अच्छे से हार्ड प्लैंक पे डॉक्टर के पास ले आए. So you being a neurosurgeon, if you can just tell us, like as soon as you see a patient coming, so what are the first few things that you act upon?
See, usually when patient come to us and we take the detailed history, like why the history is important to us, like we'll come to know the impact of injury, net shock injury, speed of the vehicle, and all the things will come to know the severity of the injury. So depending upon the our thinking process starts there. So okay, this is the injury. So we have to take this all precautions. We have to further investigate. We have to do CT scans. We have to do MRIs, then clinical examination, whether what level the injury is, because clinically we'll come to know depending upon the nerve loss, sensory loss, or motor loss. We'll come to know this is the level of injury. So what segment we have to go with the MRIs, with the CT scans. Okay. After doing all this workup, so we will further proceed with our further management. If the injury is very severe, so that whole spinal cord is contused, so we will think twice for surgery. If it is a stable fracture, we think okay, we do with the conservative line of treatment. If it is unstable fracture and it is further going to progress this one, then we'll go with the surgical line of treatment.
So, one thing more, like when we were discussing earlier, you just mentioned any therapies or something, right? So, in hospitals, we usually have these physiotherapist departments and psychologists and nutritionists or dietitians. So, do you think all these health professionals are of any help in these cases for you? Of
Yes, definitely. Yes, definitely. Spinal injury, or you are talking about the brain injury. Any of the injuries, especially these are the central nervous system, it supplies to whole of the body. We need a team for it. Neurosurgeon alone can't do this work. No, he can operate the patient, but what about the counseling part? Who needs to give the motivation to the patient? That is a therapist, psychotherapist, or psychologist can give that part. And see, as the patient is bedridden, so our nutrition will definitely go down. So we need a nutritionist, so that proper nutrition should be given. And I want to add up one more thing. Psychotherapist is not only for the patient, but to the persons who are attending them. That is also very important, because if they are talking about the financial losses, about the home affairs and all the things, definitely they will be more in psychological disturbances. So we have to train them also. And nutrition part, nutrition is not only up to the what they are taking it, and about the hygiene also. So this hygiene will be educated by our nursing staff. They will tell us, they'll tell the patient okay, what hygiene things they are supposed to do to clean the lower part, or to clean the tubes if they are feeding with the nasogastric tube, and what we are supposed to do after the feeds, or before the feeds. This all the things will be taken care by the our nursing staffs. So in total, physiotherapist, definitely physiotherapist is something like people will think sir has done the surgery, no it is enough. No, it is not like that. Remember one thing, nerve regeneration is very less. Nerve can regenerate it, but the time taken will be very much. See, the nerve recovery and muscle recovery, there are two different points. Nerve recovery can happen with the time, but the time lapse, and by that time, patient will lose the muscle mass, right? So to have a body posture, to patient to person to walk it, we need both the things, one nerve and one is muscle. Definitely bone is also required, so muscle mass is also required. So patient will tell sir, I am feeling the sensations, I am doing well, but I don't have muscles. Why? Because during that period, when you wanted a physiotherapy, you have not done, by thinking that neurosurgeon has done the done work. No, it's not required. No, physiotherapy is equally important to keep your muscle mass intact. As once nerve surgery, as once nerve is repaired, nerve is regenerated, nerve is recovered, muscle mass will be not be there. Then we face this kind of questions. So physiotherapists will definitely play a role. Daily physiotherapy, or as per their requirement, they have different modalities. They will do that one to keep the muscle mass
so these
intact. So once nerve is developed, the muscle mass and nerve both will help the patient to move the limbs.
and these physiotherapies are
That
for
is
the
the
long
reason.
term, like months or years that is go on, the goes on, or how?
No, no, no. It is not like that. Initially, it requires, with the time we will reduce down. Like initially, we for a month we might require for a month or 2 months. Then we will do alternate day or once in a 15 days. Then slowly, by seeing the progress once in a month. That's all. Afterwards, they can do by themselves. See, doing themselves is as a must. That can be a lifelong. because as the nerve is little damaged and nerve does not have that much strength, so you should take care with the muscle mass. So exercise is must
exercise
for all the time.
for the life. So these are quite, experienced. You have such a good experience that these suggestions are coming out so well. Also, with this, all this, I would like to know: do you have some key messages that we can share with our viewers?
Yes, the important message I want to share to everyone is kindly whenever you see the road traffic accidents, don't get panic, don't run away from the accident site. Be bold that you are not going to be get sued for that help. That's definitely not one thing. And second thing, don't use your cell phones when you see any victim. If you want to really help by using the cell phone, just call to the ambulance and get a help from them, or call to the nearest doctors, because all the national authorities have their emergencies numbers, including the hospital number. You can get connected to the orthopedician, to the neurosurgeon. Sir, we are seeing this kind of accidents. What is the first aid we can get it? Or to the any health authorities. You just call them, or any of your friends who are known to you who is doctor. You can take their help. Ask them what is the first aid we can give it. So just give the first aid to the person. You can save life. You can save the limbs. You can save the families. You can save many more things. That is my takeaway.
Definitely. So I think this was very helpful. Thank you, Dr. Adil. It was an honor to have you with us at Medwiki. And I'm sure that you have such a great experience, and your suggestions will definitely help our viewers. Especially, first thing that I would say is that how they can prevent these spinal injuries was the best thing, because, as you just mentioned, that people know that they should put on the seatbelt, but they don't. So I hope that this video gets them insight that, start taking care of yourself, because if the time is gone, then it's a lifetime problem. And definitely hearing from you
True.
that what should the people do, the people who are standing around, rather than just taking photos and pictures. So it was a very nice thing, because we are trying to help, but how to help is something very important. That has come out from this conversation. Thank you so much. It was a very pleasure to have you here. And one thing,
Thank you very much, Ms. Prerna. It was a great pleasure to share my knowledge with you people. I hope many viewers and will watch it and will follow it, and give a good message to the other people. Thank you very much.
this was very helpful. We might have you on board again for any other.
Sure, it will be my pleasure. Definitely, it will be my pleasure.
Thank you.
So, thank you.
So, viewers, I hope this video was helpful to you. Keep watching our videos on Medwiki channel for more such informative videos. Please do not forget to like and subscribe to our channel Medwiki.